Mr. Speaker, I was pleased yesterday when the Premier acknowledged that a Liberal government in Manitoba will address the fact that under the NDP, we now have the highest prices for liquor in all of Canada. The Premier...
That is true.
Mr. Speaker, the Premier may also want to note that all but one of the other provinces has lower rates of alcohol addiction than Manitoba, regardless of their liquor sales model. If the Premier believes his current alcohol sales model is more socially responsible, why does Manitoba have the second highest rate of alcohol addiction in Canada?
Mr. Speaker, I remember when the member from River Heights was advocating that we put special labels on bottles to warn people of the dangers of alcohol. That was before. Now under the new leader of the Liberal Party, they've abandoned that policy, and they're promising cheap booze to Manitobans as an election gimmick, Mr. Speaker, similar to what the Conservative Party is doing as well. Low-priced alcohol does not lead to social responsibility, Mr. Speaker. It does not lead to social responsibility. We have a policy with our Crown corporations of 2% of the profits being invested in social responsibility. That's the best policy in the country, Mr. Speaker, and we will continue to work with community organizations and families to make them aware of the dangers of overconsumption of alcohol and indeed all drugs in Manitoba, Mr. Speaker. That's why we will keep liquor and lotteries a public Crown corporation owned for the people of Manitoba, and we will not follow the policy which we have just seen in Saskatchewan, where they are going to privatize all of their liquor stores, Mr. Speaker.
Mr. Speaker, 11 provinces which have lower prices for liquor than Manitoba also have lower addiction rates. Wow. Mr. Speaker, yesterday the Premier accused Manitoba Liberals of reducing support for the prevention of addictions and FASD, and yet the NDP approach of just throwing money doesn't bother to assess if there is even a net effect in reducing addictions and FASD. The evidence-based approach of Manitoba Liberals will actually measure if spending effectively meets social objectives. Can the Premier table today evidence that his current approach is effective in the net reduction of addictions and FASD?
We have a very strong commitment to young families in Manitoba, Mr. Speaker, including prenatal benefits, including a Families First program, which provides home visits to new families when they're starting off to give them the support they need. We are going to ramp up those programs, Mr. Speaker, to support even more families in Manitoba. We've expanded, doubled the number of daycare opportunities. We call it early childhood learning now because there is support for families there. We have family resource centers in Manitoba that we support, Mr. Speaker, under the Neighbourhoods Alive program. We do a lot of work with families at the neighbourhood level. We have a fetal alcohol spectrum disorder program to support young families and families in Manitoba, Mr. Speaker. All of those programs we've improved upon and expanded in the budget, Mr. Speaker, and the member from River Heights has consistently voted against all of those measures in our budgets. And now he wants to lower liquor prices. There is no research anywhere that he can show me that lowering liquor prices leads to greater safety and security and better results for families when it comes to alcohol consumption. I challenge him to put forward the evidence that lowering liquor prices will make families safer in Manitoba.
Mr. Speaker, the Premier forgot to table the evidence I asked for. Maybe, as Scott Forbes said recently, this Premier doesn't believe in science and evidence. Mr. Speaker, the Premier is right that Manitoba Liberals will reduce liquor prices through changes which include allowing more competition and more choice on price, quality and variety. Such changes in liquor policy are long overdue in addressing the gouge and no-choice approach of the NDP. The Premier can scream at the Liberals if he likes, but the reality is that Manitobans want choice and affordability, and that's what Liberals will ensure. Why are the NDP stuck in the belief that they know better than Manitobans so that their government must control choice?
Mr. Speaker, Manitoba funds world-class research on fetal alcohol spectrum disorder, Mr. Speaker. Dr. Chudley's a part of that. We've been very supportive of his research. I've met him in countries around the world where he's there doing research with other parts of the world. That research is being The leadership on that research is coming out of Manitoba. We have funded that with the profits we've made out of the liquor and lotteries, Mr. Speaker. We have responsible programs. We train everybody in a hotel to be responsible servers in Manitoba, Mr. Speaker. We train our staff in the Crown Corporation that provides choices to Manitobans, among the best choice anywhere in Canada, Mr. Speaker. We train them on how to help people make responsible choices. We will continue to do that, Mr. Speaker. We have reduced the red tape on all the regulations with respect to liquor, Mr. Speaker, but we have not abandoned social responsibility. As we make more choices available to Manitoban, we've also increased social responsibility and dedicated more money to that. I ask him, where's the research that shows lowering liquor prices makes Manitoba families safer? There is none. He's making it up on the fly, Mr. Speaker.